everybody. It's nice to get together with a few folks and work on something together. And it's the first time we've really had this kind of a group with the animal volunteers. And so the agenda, I think, is going to be something that hopefully makes a difference for your animal welfare concerns. And so let's go ahead and with no further ado, let's go ahead and take a look at the Board of Health minutes from July 16th, 2020, and give you a second to look at those. And then anybody who wants to approve them, move.
I had a question about them. I don't remember Chief Short being there, but maybe that's just my memory.
Chief Short joined the meeting. He did not speak during the meeting, but he was on because he was curious and was ready to answer questions should they come up when we were discussing the different protocols we had for staff. He's on the incident command team, so he wanted to be there essentially as backup. But he.
Yep, one of the city council people, I think, also was sitting in the background because we had a conversation afterwards. So.
Okay, anyone want to move the minutes?
So moved.
Second.
All in favor, say aye.
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 Aye. You got that, Christina? All right. Okay, our first item on the agenda is the review of joint subcommittees report regarding breed-specific legislation. Let's go ahead and invite Jason to introduce the topic and share with us what the committee accomplished.
Jason White here. Let me briefly sort of run through how we got to the report and introduce the other members of the committee. So on the committee was Tim Watkins and Cindy Marshall from the City County Animal Welfare Committee, and Dr. Wingert and Dr. Morris from the Board of Health, and myself. You may recall we got here because in about April or May of last year, the mayor asked both bodies to look at the status of the breed-specific ordinance here in Independence. We all got together and concluded let's just have a joint subcommittee, and the five of us were noted to take that responsibility. We started meeting in the fall. I think maybe we had a meeting fall of I don't know what to do.
If you guys aren't speaking, if you can mute or move away, that'll help a lot. You want to try again, Jason?
Happy to try again. I think our first meeting was probably in August or early September. As we got done with our summer activities, we had three meetings. We ended up having a hearing that was very well attended and very respectfully attended. And the result of that, the following meeting, the subcommittee came to closure on our recommendations. I was quite open, and it was my intention to not spend my holiday time working on the draft, but I was also concerned about inserting a report into the middle of the city election process, which had February primaries, and at that time we thought an April election. I was not in any hurry to get a draft before the subcommittee. Throw in a pandemic and moving the city elections to June and some health issues, and we're getting the report in front of the two parent bodies now. So if there's fault to be presented on the timing of it, that falls on me alone. The draft report was prepared and provided out to the subcommittee that approved it. The rough outline, you've had a chance to review it, but the rough content of the report was a review of the committee membership, our process, sort of giving a reflection of the work that the various members of the committee had done, and what the committee had done as a body. So, as well as linkage to a variety of associations, positions, articles on the history of the issue and independence, as well as articles of the current media really around the hearing that brought out a lot of media interest in the issue. So we sort of tried to present the breadth of the review that was done by the committee. And I would say I thought it was a really good group. I mean, we got at it and had good discussions and sort of came together on a recommendation. That recommendation is found on page 8. The summation of it is a recommendation to repeal what is known as the Pit Bull Ordinance. We are the couple of points, and I'm trying to read what you can read yourself, but the rationale for that was based in no priority order on the reality that it's hard to determine what is and what is not, creating a real fairness of enforcement question. The evidence suggests that you can have problem behavior, problem dogs in a variety, regardless of breed, and singling out one creates a real false sense of security on behalf of the public. And that in and of itself was a persuasive point to me. We created a facade in providing safety to our citizens by having a pit bull ordinance, when in reality a large variety of animals are large enough to inflict serious harm, and all breeds. And in talking to folks that are very involved in animals, it was interesting to hear how they all had different breeds that they sort of kept an eye on out of the corner of their eye while they dealt with them. So not something to be said. The enforcement is predicated on turning in your neighbors and people trying to determine whether that's a pit bull or not when they're calling to ask for enforcement. And the reality that of the professional groups, the ASPCA, the veterinarian groups, the municipal legal, the American Bar, there is a body of professional evaluation nationally that indicates that's just not the way to go about trying to protect the public from dangerous animals. We spent time looking at our dangerous dog ordinance, and we had benefit of some feedback from an attorney who specialized in that and access to the national standard template. The feedback we got was Independence has a pretty good one, and I may be wrong and somebody may correct me, but I think it had assessment and some adjustments just 2, maybe 3 years ago now. We still provided some thoughts, some ideas that the council might consider. I won't run through those. There's nothing in weight and there's nothing in priority there. But there's always a chance to improve things. And it seems like if the council is going to consider a step of removing the dangerous dog ordinance, it's also an excellent time to spend some time, removing the pit bull ordinance. It's also an excellent time to review the dangerous dog ordinance. So that's the report. It was approved by the subcommittee. I think the last one of us that reviewed and was good with it was on July 20th. The process from here, it's now before the two bodies. If these two bodies separately approve the report, or we all collectively accept changes, then the report would move from here this evening back to the mayor and the council for their consideration. Getting a little off topic, the reality, our responsibility is to provide a report. We're close to accomplishing that. The reality is the council has a set of options, and I would like to touch on them because, like it or not, all of us will be part of the conversation that will ensue from settling on a report if we do so as two bodies this evening. The council is within its authority to accept our recommendation and have an up or down vote and decide on eliminating the pit bull ordinance. They also have the opportunity to say interesting topic but this was brought before the community some years ago vis-a-vis a petition that demonstrated a strong feeling of concern on this issue. Over 4,000 signatures were gathered, and they may remand it back to that same process. They may choose to put it on, and if they go that way, that creates, if the petition drive were to be done, if a significant number are gathered, then the council is presented with the option of putting it on the ballot for public vote or making a decision at that time. Just playing a little bit of that out. We are in a pandemic, which makes gathering signatures in a petition maybe not the safest endeavor. The other thing is it pushes the issue out into, to 2021 easily. The third option seems to be the council could go ahead and directly put the issue on the ballot, and they still have time, if they wish, to consider a November ballot. The fourth option that's not as readily visible, but I would want to make sure folks are conscious of, is there's a lot of energy on this in Jefferson City. And legislation's been filed several times over the last few years that would have state law prohibit cities and counties from having breed-specific ordinances. This last year, it came close to passing. It had a vote in the House, and I do not recall the numbers, but it passed handsomely, and it was then caught up in the bizarre session of the pandemic and was attached to some bills, but none of them got through the final process. I certainly would not want to bet on passage or not, but I would just point out to the two groups that effort is going on, and in a political process, it's made great strides to move towards passage, which would make all of our efforts in the city councils stand on it mute. So the effort tonight, are there issues, questions, concerns? And I'm hopeful that Cindy, I apologize, I'm on the phone, but I'm hopeful Cindy, Tim, and Dr. Weingart, I know Morris is here, and they may have other things to add or correct on my verbal comments. And they're certainly available to answer questions or respond as well. But my hope was we could respond, and if the two bodies are comfortable, or if we can come to acceptance of any recommended changes yet this evening, that we might be able to get passage of endorsement so that we can move it on to the council. There you go, Dr. Ruckman. We kept it fairly short for me.
I'm impressed, Jason. That's pretty excellent report. And after having read it, I felt like you guys really did your homework, and it was well written and very thoughtfully put together. So I personally don't have any issues that are glaring. So if there's anyone that has a question they would like to. Okay. My speaker started working on my computer, and that's why it was echoing. Okay, I turned off my phone. All right. So back to the questions and any concerns that anyone has about the report, additions, deletions. Wow, I'm speechless, Jason. You've done such a tremendous job. No one has much to say.
Oh, God. I know it wasn't my report, but if indeed we're at that point where the two bodies have no questions, comments, or changes, I guess for a matter of process, Christina, my gut tells me we want to vote by both bodies separately. Is that appropriate, or should we just have one vote of both bodies and consider it done?
Well, just so it's clear, I think we should have a vote of both bodies. And if you guys don't mind, I was going to do a roll call so we can make sure that it's clear that everybody voted and or abstained or were not present to vote, so that we can be absolutely clear when I carry this back up to the council exactly what the vote was. if you guys are okay with that.
I would like
That
to
sounds good.
I would like to suggest possibly that we vote as two separate committees and make it that way you have both. You know, the separation will give it a little bit more of a visual effect, and just a statement that the two bodies voted unanimously or whatever individually, I think would make it a difference.
If you're okay, then I'm going to go ahead and start with the Animal Welfare Committee. And I will call out your guys' names, and if you could yay or nay or abstain. Tim Watkins,
Yes.
Jack Cardwell. I don't believe he's present this evening. Linda Humphrey,
Yes.
Vance Spearman, I see Vance on here. Are you able to unmute, Vance? We'll come back to Vance. Cindy Marshall. Well, I know
Yes.
Cindy was on here. Yes,
There.
okay,
Okay, hit it again.
no problem. Vance? We will come back to Vance at the very end. I'll move to the Board of Health members. We do have, though, 3 yeses, so you do have a vote of approval for the Animal Welfare Committee. Dr. Ruckman?
Yes.
See? I don't believe she's present this evening. Dr. Morris?
Yes.
Dr. Wingert? I don't believe he's present. Kathleen Bennett? I saw your mouth move, Kathleen, but
Yes.
there you go. Dr. Potts? I see we can't hear you, Dr. Potts. Not. If you need to, you can go to the chat bar and I put in the information about how to call
Okay.
in. Oh, there you go.
Now, okay, thank you. First of all, you need to realize that the Robert's Rules of Order asks for comments before the vote is taken after it's stated, and that has not been done, and that's what I want to do right now. Any objections?
No.
Okay.
Nope.
Okay. Basically, it looks like the outcome of this has been previously determined for some time now, even by comments by the chair about what they expect out of this, and the statement of unanimous, unquote, period. I do not want this committee to tell the city council that this was unanimous vote because of my experiences. I am violently opposed to changing the ordinance, okay? As far as I know, unless I'm wrong, no one in this group, either group, has taken care of children that have been bitten by pet bulls. I have. And I will never forget some of the terrible things that were done by those animals to a child's face and ear and to another child's leg. And I know these were both by pit bulls. I've taken care of a few others, but those are the only ones that involved the pit bulls. Anyway, I just wanted to let you know that please don't let anybody think this was a unanimous vote, and that I had pretty good experience in taking care of these kids that were bitten by the pit bulls. And I'm certainly against anything that's going to change what we have now. So I vote no, as if you haven't figured that out.
Any other comments? We'll make sure that we provide you an opportunity. Anyone else that wants to speak or address the issue? Okay, thank you, Dr. Potts.
You're welcome.
Dr. Ruddy? We can't hear you, Dr. Ruddy.
You hear me now?
Yes.
Okay. I'm good. Yes.
Dr. Nelson? I see him on. Jason White?
Yes.
And Shauna Jackson?
Yes.
One last time for Animal Welfare Committee, Vance Spearman? Your hand is raised. Is that a yes? Well, here, let's try to unmute you, Vance. Vance? Nope. Okay. Well, we have the votes for both the Board of Health and the Animal Welfare Committee to go ahead and pass it. So I will prepare essentially a letter that will go up to the mayor and the council along with the report. It will include the minutes from this evening, and it will show the votes and present the report as a joint report from the two different committees. And I will then ask the council how they would like to proceed.
Okay.
Sounds good to me.
I just want to make a comment regarding what Dr. Potts shared. I don't want to underestimate the significance of what he experienced, caring for kids that were mauled. I think that's a tough thing, and I would really, I can appreciate his sense of, horror from the results of what happened. The thing that I am more concerned about is I would even go for a stronger, I don't know what you could do more comprehensively than what we already are, based on everything I've been told about the dangerous dog ordinances. But I think, the thing that I find that, we still have pit bulls throughout the community, but they're not being monitored or not being seen by vets and stuff as much as they really should be. And so I'm hoping that the pit bulls that are being hidden in the background of the community might come forward and at least be so we can identify them and make sure that there's no health issues that would make it even worse if something were to happen. But that's my concern, and the dangerous dog ordinance is probably the most important part of this whole discussion, in my opinion. And I just wanted to share that. Any other comments before we move on?
Yeah, Ralph, part of the conversation that went on in the committee meetings and with a look at the medical and veterinary literature and ASPCA and all the other organizations that aren't necessarily biased one direction or the other, trying to look at data, was that education of the public and participation of the public was really the key to having dangerous dog ordinances that worked. People have to be willing to say, my neighbor's dog lives on a chain 24/7, and gets fed once a week. And if they're not willing to know that, to do that, then when that dog gets off his chain, that's a dangerous dog. And so I think the educational piece is something that isn't necessarily addressed in our current legislation and probably should be. We need public to be aware of what the ordinance is and how it functions and how they can make it work for them. Just my 2 cents.
You want to unmute yourself, Dr. Potts? We couldn't hear you.
Yeah, I unmuted it once. It decides
There
on
you
its
go.
own. Okay, I wanted to thank you for your comments and opinion. Whatever I can do to keep whatever bad animals out of the city, I'd be happy to do that. But I don't really see this as helping that much. Maybe it is. Hopefully that's true. I read a lot of the articles that we talked about, and I didn't change my mind at all after taking care of those 2 kids that I had to take care of. I'll never change, I don't think. But thanks all for listening.
You're welcome. Any other thoughts? Okay, hearing none. I'll offer to any of the animal people that are still listening, if you would like to stay, you're welcome to listen and be a part of the meeting that we're going to finish up here with. Otherwise, you're welcome to go ahead and hang up, and we'll probably see you at a city council meeting sometime soon. All right.
Thank you.
You're welcome. All right. The discussion on COVID-19 outbreak. Christina, you want to go ahead and share what you're...
I am happy to share. I'm also happy to open this up to any other comments you guys might have. Looking at the numbers, you know, I shared a little bit with the council this last week, and I was told that I should have been a lot more specific, so I'm going to try. If we look at the total number of cases that we had in March, April, May, you'll find that combined, we had more cases in June than March, April, May. And then if you look at July, you'll see that we had more cases in July than we did in all of March, April, May, and June combined.
Christina, am I assuming when you're using the word we that you're talking about independence? Because that's data that I'm not able to sort out on my end when I look at this every day.
And I would be happy, there's an information only piece that I've been giving to the council at the regular city council meetings, the non-study session ones, that's down at the very end, that is broken out by zip code. But if you look, you'll see, and if we're looking at historical data, you can look and you can see that Independence and Eastern Jackson County follows the same trend. We're having more cases at a faster rate. In July, we had quite the, I mean, essentially exponential growth is what we were seeing in July. And for many of our zip codes, if you'll look at the information only piece, you'll see that 4 of the zip codes that are in Independence had growth that was more than 50% in a 2-week period, and it was more than 50% of their overall cases from March through mid-July. We saw more than a 50% increase in cases, some of them over 70% increase in cases. For instance, 64053 had a 77% increase in the number of cases in a 2-week period compared to that total leading up. 64057 had a 70% increase in the number of cases. As some of our zip codes, the percent positivity for the last 2 weeks was actually not, I mean, it wasn't good, but it wasn't bad. For instance, 64050 had a 5.92% positivity in the last 2 weeks. But then 64053 had a 21% positivity rate in the last 2 weeks. As a whole, our zip codes had about a 10.24% positivity rate. Right now, Eastern Jackson County as a group has about a 15% positivity rate. And I mean, of course, the higher the percent positivity rate, it means a lot of things. It means that we're not testing enough. Whether you're looking at World Health Organization, or the CDC or Harvard Global Health Institute or Johns Hopkins, I mean, they're all going to say you want your percent positivity to be as low as possible. Then you know that you're capturing all of those cases. So you want that number to be, depending on who you talk to, either below 5% or below 3%. You know, we're above that. We're well above that. They also look and they say that you shouldn't open up and start your reopening until you're below 5%. Well, you know, the horse is already out of the barn. It's already running away. We've started our reopening. We're definitely not below that 5% like we should be. But it's also the reason why we shouldn't be advancing our phases, is because we can't get it below that 5%. So we should not be trying to open up more if we can't get it lower. We continue to not be testing enough. We know that because estimates, again, I went ahead and relied on Harvard Global Health Institute has this wonderful matrix that looks at individual states and what is currently happening to estimate how many tests should be done per day per 100,000 residents. For Missouri, in order to mitigate the pandemic, they say that we should do about 212 tests per day per 100,000. And in order to suppress the pandemic, we need to do 763 tests per day per 100,000. Right now, we're averaging about 142 tests per day per 100,000. So we're not even getting the number of tests we need in order to mitigate, much less suppress the pandemic. And we're definitely not catching all of the positive cases. There are multiple reasons for that. There is a delay in getting test results back here in our area. So when you have a delay of over 14 days to get your test results back, it makes contact tracing and case investigations difficult, if not impossible, and pretty fruitless, in all honesty, because that person has normally already spread everything to everyone and has stopped being normally infectious at that point. There's also just, I mean, there's a lack of testing reagents, and so there's a lot of requests that there be a focus on those that are symptomatic, because although we may have enough tests or we may be able to get enough people together to go do a testing clinic, if there's not the reagents there, then they have to prioritize who they're going to run the test for. So they've actually backed off on the testing for our area because of that. It's not something that we're just seeing here, but it is something that's a real problem. And it's continuing to be a real problem. We're not hitting any of our gating criteria. PPE is becoming an issue that we are having reported to us that it doesn't matter essentially how much money you have. It's going to be hard to get a hold of that PPE that you need in order to do some of those functions you need. And I'm talking about, you know, long-term care facilities having issues, schools having issues getting a hold of it. The city's doing their best to work every channel we can to get that PPE, but it's something that's going to be an issue, especially as we're moving back towards schools reopening. So I know that was all doom and gloom, but do we have any questions?
Got a comment and then a couple questions about our local. One possibility that's been kicked around, and I haven't seen anything in the last 48 hours, but the CDC is entertaining pooled testing, where instead of me submitting my specimen and it going off and sitting at Quest for, you know, a month, I have a pastor that was exposed 3 weeks ago, and he still doesn't know whether he was positive or not. But they're starting to look at pooled testing, where they'll take 100 samples, put them all together and test them, And if that sample is negative, then nobody's got COVID. Now, if that test is positive, then supposedly the technology, and I don't know if it's true or not, I don't believe everything I read, but supposedly if it's positive, then the clinical lab can then go in and test each one of those specimens. But that way you do 100 tests at a time so that you use less reagent and you're not testing, you are testing everyone, but not each individual person. So that's possibly a light in the future. I've had a couple conversations, one with somebody that actually knows something about that, and he assured me that actually was done in China and worked very, very well there. Don't quote me on that. I don't ever want anybody to believe I love China, because then I'll go wherever it is bad people go. But that seems to work in other places, and so Missouri is looking at that. So that's kind of a light in the future, perhaps, as far as our ability to get testing done. You can't invent machines and you can't invent technicians to run them overnight, and there just is not the clinical people to do the test, I've been told. So until you get the kind where the nurse can do it, like you go in to get your strep test or your influenza A or influenza B, until you get that kind of test available, you're still going to be waiting 14 to 21 days. The two questions I had, one was on the data that was available today on the county website. Independence had 3 out of the top 4 hotspots. We had an outbreak in Independence Manor Care Center with 75. The Groves with 51, and the Villages of Jackson Creek with 32. Where's the city in that mess, and are we feel pretty confident with those are controlled?
I'm never going to tell you that I'm absolutely confident. I'm going to tell you that what we're doing is we're continuing to do what we've done before with the outbreaks in the long-term care facilities. We're reaching out, we're offering to get whatever PPE they need. We're making sure that they're getting the testing. We're offering anything and everything to be of service. At least one of them actually has an outside group that essentially their corporate sends in whenever this has happened across the country, unfortunately, to do mass testing and to help keep that under control. I can tell you we're doing everything we can. With COVID, I'm never going to be able to tell you that I'm confident we have this under control, because it's sneaky. And so what we're going to do is we're going to try to make sure that they're getting that they're getting the testing that they need, and that they have the PPE they need, and whatever else they need in order to get through this.
My other question had to
Christina?
do. Oh.
Yes, Shauna?
I was going to ask if Christina could. Can you speak to what Jackson County is doing in our long-term care facilities?
I can't speak with authority to any single one of them. I can tell you that I know that they've been in contact with them. They, in most cases, are allowing us to provide the PPE and to help out with that. They are a little overwhelmed on the testing, so they're very happy when there is a corporate group that's able to come in and help with that. But they are trying to stand up a special testing group in order to be able to go out to these hotspots and have it, they have their mobile testing sites that set up, but they're trying to set up testing groups that specifically go into these outbreaks and these hotspots to get it done. That's supposed to happen this next week.
Thank you.
My other question just had to do with the breakdown of the deaths by ethnic group, and I have some acquaintances in the Pacific Islander group, and apparently there's an extraordinarily high death rate and incidence rate in the Pacific Islanders, which makes up a pretty significant chunk of part of Independence. And I just didn't know if there was any comments on what was going on there.
You know, there's lots of reasons why it could be. I know one of the things that we've done is we're trying to make sure that we get more testing to some of those areas where there are more minorities, more ethnic groups are represented, because we know that they are being hardest hit. You know, disproportionately, we have set up a society where there's a lot of health inequities, and we need to be honest about that, and honest that you know, they may not seek healthcare at the same rate. There may be other issues. So we have asked the county that some of their mobile sites, you know, this next week, they're actually setting up in Fairmount twice next week for mobile testing sites. And we're asking for them later this month. We're trying to convince them to move to Northeast Independence so that they can hit some of those areas. So we can try to get the testing done a little bit better and see if we can control it, because you're right, it's unacceptable for us to have that disproportionate, you know, those health inequities we shouldn't be seeing here. I love Independence. We have plenty of access to healthcare. We should. So we need to make sure that all of our citizens are having access.
Thank you.
Jason here. Can I get some questions? And I'm not an expert, so I'm hopeful others may. My wife and I have noted a data issue, and what we hear from the nursing home where one of my loved ones resides is radically different than what we see in the newspaper and what we hear from the county's data. So I guess I don't know what to do about that, but I'm puzzled that the nursing home is telling us they are done. They've got all their patients, everybody that had it is recovered, and they have zero, and yet the other entities are reporting significant numbers. So I guess I'm curious how, if there are other inequities in the data and the explanation from the professionals in other sites here in the city. Number two, how is our hospital status? So are we okay on hospital beds in the metro area? And I'm a little out of date on some of that, so I am real curious because I read the national numbers. And my third comment to get out is I out of date on where we are with our school startup. Aren't our schools are all still planning on starting up? And do we have is the status of the outbreak in Independence with 15% positive rate something that this body can speak to with regard to school? Thank you. We'll go back to mute.
Can do that.
So for long-term care facilities, I can tell you that we're continuing to follow up. I mean, I am not, unfortunately, I am not aware of, I'm sure, the status of every single long-term care facility in the city, but I could definitely follow up and make sure that they are continuing their testing, because that's what they should be doing, is they should be continuing testing of those staff weekly in order to make sure that there's nothing new that's popping up. I don't remember what your second question is, Jason, so you're going to have to unmute, but I will jump to school reopening. Right now, of the 4 school districts that serve the city of Independence, Fort Osage has delayed to September 8th. Blue Springs has made the decision to delay to September 8th. Independence is going forward with August 24th. And Raytown is starting school on September 8th, but they're doing virtual for the first 2 weeks for everyone, and then in person for those who choose it after that, with the thought that there may be an outbreak after Labor Day and they want to try to not bring it into the schools. My understanding is Blue Springs, Fort Osage, and Independence all have essentially a kind of a hybrid model where parents can choose virtual or in person. For some, I know Fort Osage, they have it where if it can be in person, if you're K through 5, I believe, and then the older kids will only be in person. If they want to be in person, they'll only be in person twice a week in order that they can break the children up. So, you'll either go on Monday and Wednesday and be virtual Tuesday, Thursday, Friday, or you'll go on Tuesday and Thursday and you'll be virtual Monday, Wednesday, Friday. The schools are all doing something like that. I know they're also looking at their sports programs starting back up, including football. And the county and the city are continuing to talk to the schools and make recommendations to try to make it as safe as possible for our kids.
Christina, I might add, Mark convened the 9 area health departments with the hope of getting some uniform guidance, not only for districts, but across this region. I don't know how successful that's going to be. A complicating factor on the activities, the Missouri State High School Activities Association just came out with an announcement that says if a kid is virtual, full-time virtual, they can't participate in extracurricular activities. Some districts are choosing to say if a kid can't come to school full-time, then they can't participate in activities. I don't know where that's going to land, but I'm hopeful that with this work with Mark, that more guidance will come out. Primarily, what I'm hopeful for is more gating guidance for districts that says if the positivity rate is in certain realms, then you're face-to-face, you're virtual, or you've got some blended form. It would help across the region to have that uniform guidance, but that is going to be a challenge when, from the state level, they're saying it's all local decision. You can take your, we can all have different thoughts on that, but it creates confusion among communities when we don't have a uniform approach to how we're going to deal with this. So it would not surprise me if Independence ultimately decides to delay their start until after Labor Day. But you're seeing that across the region, whether it's on the Missouri side of the state line or the Kansas side of the state line. And as the positivity rate grows, more and more virtual. I will say that you're also seeing that approach from most districts that recognize, particularly the early year learners, it's not good candidates for virtual learning. So that's why the effort is kindergarten, first, second, third, fourth, to have them in a face-to-face. And if you can get enough of your older kids to choose that virtual option, then you can create the social distancing by using other facilities to create that. So it's an ever-changing and evolving, as everyone knows, but that's where things stand at the moment.
And Jason sent me an email reminding me hospital status was his second question. Right now, I understand that. I mean, we do have enough hospital beds. We are seeing, we have been seeing hospitalizations still grow. There have been some complications. Jackson County, for hospitalizations, their reports aren't based on information directly from the hospitals. Their reports on the number of people hospitalized for COVID are based on contact tracers and their reports. So often they're getting this information from people who have just been released finally from the hospital, and they ask the question of, did you go to the did you have to be hospitalized for COVID? And that is where their number is coming on their website, which is not the ideal way to get that information, but there is, for some reason, a real disconnect right now in trying to figure out what those hospitalizations are. We know we have beds available. We also know that our hospitals are feeling a little bit of a strain, and some of them are asking for, they're having the same issue trying to get those testing reagents to get people tested. They're moving them to certain hospitals to make sure that they're in isolation.
I'm listening to this.
It's not the best solution. But it's where we are right now with hospitals. And so they are supposed to be working through Mark with the Hospital Coalition to try to find a better way to get that reporting directly to some of our local health departments who don't have it.
Yeah, one comment on that. There was about a 2-week disconnect without waxing horribly political, where the White House decided information from the hospitals no longer went through the CDC. It went through the White House and then back to the CDC. And so there was about 2 weeks where Missouri actually had no data whatsoever on that, on hospitalizations and death rates in the hospital and that sort of thing. So we were kind of going blind during that time. Jason, if you look at the Eastern Jackson County data, and you look at their hospitalizations, we actually, it's fascinating because I sent a little clip of this graph. It's got ever since January, and if you look at what the hospitalizations looked like in April and May, and then you look at what they looked like in June and July, actually my wife couldn't sleep last night because she looked at that data. It actually is amazing. And although hospitalizations haven't gone up hugely, we've gone up from an average of 1 per day to 2.5 per day. Well, that's 150% increase in hospitalizations. And so that really is fairly significant and something we need to look at. Interestingly enough, we made the NBC Nightly News as a hotspot today. Kansas City did. Another place you can look is the IHME website, which is the Institute of Health Metrics and Evaluation, and they are basically number crunchers. And if you look at their number, it actually shows the number of available hospital beds, the number of ICU beds that are available, and looks at them daily and breaks it down by state. And if it follows the milder trend, they kind of have a worst case and an average and a best case scenario. And if you follow the best case scenario, we run out of hospital beds on November 1st. So I'd like to paint a rosy picture, but the picture ain't rosy, so I can't paint it that way. So assuming we all behaved and did what we were supposed to do, we're probably still going to run out of ICU beds in the fall, assuming we don't have a huge, big second peak. And kind of the purpose of all of this from the beginning actually hasn't been to prevent illness and death. It's been to prevent overwhelming the healthcare system so that you're not having to decide, okay, well, Morris, you're over 60 and that other person is 30, so you're going to die. They don't want to have to make those decisions, which they may eventually have to make.
Christina?
Yes, Shauna?
Does the City of Independence still have a representative on Emergency Services Committee?
We do. Emergency Services Committee, though, hasn't met for the past couple of months because of the COVID crisis, and so we haven't been meeting. Dr. Duncan still serves on it for Centerpoint, and she has been. Well, many of the Centerpoint people have had, honestly, a whole bunch of other things to do, and AMR has been stretched thin. So yes, we do. Chief Short and I still serve on it, but we have not met recently.
Because back when we had a health department, that would have been the group that would have been very active, I think, during this time, busy or not. And that's how you share information with your health department and AMR and Centerpoint and the fire department.
Isn't Dante on that committee, Christina?
What was your question, Dr. Potts?
Isn't Dante on that committee, the emergency preparedness from the fire department?
Yes, Dante. If Dante can't be there, Jeff Hinkle is there. I'm there. Chief Short's there. A member of the police department is usually there. We have quite a few members who serve on it. And in all honesty, it would be helpful in a lot of ways for us to have those groups and have those meetings. Now, of course, it would only provide us that hospital data for Independence. But we definitely do need it. And I know Jackson County has needs a good way to get that information too. So we need to look at good methods for accurate data to be coming through.
Those meetings were a link through real-time data, real-time information about what was going on in our community.
Okay, any other thoughts? Christina, you think there's any other things, any other thoughts that we should consider before we close the meeting?
No, we've covered a lot, but if you guys have any other questions, we're here.
Okay, well, I hear a motion to adjourn.
Well, can I just a second?
Sure.
I think we need to acknowledge that we owe Christina a huge vote of thanks and appreciation for the work that she does for this committee, especially considering the tasks that the city has added to what she was doing. And I think we really ought to appreciate her more.
I agree. She does a tremendous job, and she's works hard. She puts in a lot of extra hours, and she's never complains. She just does her job, and she does it well. And thank you, Christina.
Yep. Yeah. Make sure we get it in the minutes.
I will do that. I am happy to serve my hometown. I love it. So.
Well, very good.
That shows, Christina. Thank you.
Any motion to adjourn?
So moved.
Okay, a second. Let's call it a night. The
Dr.
meeting
Ruddy.
is adjourned.
Stay well.
Dr. Ruddy, did you have a question?
I
No,
think
he was just
he was seconding.
in a second. Everybody.
Okay.